In the UK and around the world, vaccination has saved more lives and prevented more serious illness than any other advance in recent medical history. But our traditional focus on vaccination for the young may no longer be enough, particularly as we face the global issue of antimicrobial resistance. Nick Thatcher talked to Pfizer about the vaccine success story in the UK and what more can be done.
Good morning, David.
Good morning,
nice to
Dr.
see you. How are you this morning?
I'm a bit tired, maybe a little breathless.
Dr. Ben Marshall is a consultant in respiratory medicine from University Hospital Southampton, who specialises in treating patients with acute respiratory infections.
So how many patients do we have in the clinic this afternoon, Margaret?
You have 50 patients, Dr. Marshall.
And as a doctor working on the front line, he recognises the value of vaccinations in not just preventing illnesses, but also in reducing hospital admissions.
Often patients don't realise that they are suffering from an easily preventable illness such as influenza or pneumonia. And it's personally frustrating that perhaps we could do more in terms of public health campaigns to flag up who should be receiving vaccinations, which age groups, which patients with chronic disease conditions, because many patients often aren't aware that they are eligible for a vaccination in a cost-effective way, and perhaps don't even know that that can be provided in their own local general practitioner surgery.
But while raising awareness of immunisation and maintaining vaccination rates for certain high-risk individuals can have obvious benefits, others believe more can be done to promote vaccination through life so that preventable diseases can be reduced across all age groups and new threats like antimicrobial or antibiotic resistance can be tackled head-on.
The government are doing a great job in vaccination here in the UK, but you can't be complacent because the bugs are clever. They can come back at any time, and we see occasionally outbreaks when vaccination rates drop. And also we're getting these special bugs now that are resistant to antibiotics. And so, we need to develop more vaccines, and we need to really push the science and keep going and invest in vaccination programs and invest in vaccination research and make sure again that people are really getting the vaccines that they need.
The UK National Immunisation Programme is rightly regarded as a success story to be proud of. Vaccines have already significantly reduced the threat of diseases that were once widespread and often fatal. And after clean water, vaccination is seen as the most effective public health intervention in the world for saving lives and promoting good health.
So it has focused for the last 15-20 years very much on children and the elderly. We are now getting to a stage where the whole life course is being looked at, but the focus should be about aiming for the gold, going for the best vaccination program, trying to cover every possible individual who would benefit from the vaccination, and essentially using vaccination as a tool in the fight against not just preventing these diseases, but also wider activities like stopping antimicrobial resistance from emerging and also reducing the cost to the healthcare system.
This is the notes of one of the patients that we're following up in the clinic this afternoon.
Yes.
Who suffered from pneumonia and is coming back.
Back at the hospital, Dr. Marshall is preparing for his afternoon clinic. He raises the subject of vaccinations with all his patients, whenever it's appropriate. For protecting the public from disease, both now and in the future, is paramount to improve the health of the nation and reduce the burden on our NHS. And prevention is better than cure.